The Omicron variant has many people worried and wanting to know whether they have been infected. But before you go get a test to find out, what do you need to know? WSAV's Andrew Davis went to the experts to find out for us, and he joins us now from the Lowcountry newsroom.
Well, many questions on the virus are spreading around, like what happens if I'm exposed? When should I get tested? And with testing centers or home tests hard to find, should I worry about getting tested at all? So I went to Dr. Kurt Gamble, Chief Medical Officer for Beaufort Memorial Hospital, in search of some answers, starting with how is COVID transmitted?
When we talk, when we laugh, when we cough, we're constantly spewing out particles, and these particles have tons of Omicron in somebody that's infected. If we share air with somebody by being in the same room or in close proximity, we inhale these.
Dr. Kurt Gamble says Omicron reproduces 70 times faster than the Delta variant, which is why it's hitting so many people so fast and why protection is needed.
But a mask is a barrier, so any mask is better than no mask. Well, this can look a lot like a cold or flu, a runny nose, a sore throat, a cough, muscle ache, fatigue. So it's very difficult just based on the symptoms to distinguish Omicron or any kind of COVID from other respiratory illnesses.
So when should you quarantine and when should you get tested?
Not symptomatic and you've been fully vaccinated, you don't have to quarantine. You can wear a mask for 10 days. There is an incubation period, and we do think it's shorter with Omicron, but we think the sweet spot is probably get tested ideally day 5. A lot of places say day 3 to 5. Before day 3, you can get a lot of false negatives. Stay calm. Try to avoid emergency room unless you have significant symptoms, chest pain, shortness of breath, confusion. Not everybody needs to come to the emergency room. Not everybody needs to be tested right away. Just talk to your doc, run through the scenario, and hopefully they can give you the best advice in terms of the timing, the precautions.
Now, Dr. Gamble says the one symptom you may not be able to count on this time is the loss of taste and smell. That is not as prevalent in Omicron as it was in previous variants of COVID. And if you're vaccinated and boosted, the still chances of you getting very sick from the variant are much less, and you should be on your feet and out of quarantine much faster. Andrew Davis, WSAV News 3 on your side.
Andrew.